presentation for us. It's very exciting.
Yay!
And Nicholas, just remember, you already know us, so don't be nervous.
So thank you guys for letting me be in your staff meeting. So this presentation is for the Honors Mentorship Program, which is a program I'm currently participating in. That's why I'm here at all in the health department, is through this program. And so aside from obviously shadowing, which is what I do every week, we're supposed to conduct research throughout the year and supposed to create this capstone. And so this is a presentation of my capstone, which is on health disparities, as the title suggests. All right. So a brief introduction on me. For those of you that don't know, I'm a senior at Westersight High School. And some fun facts about me, I guess, is that I was born in Colombia and I came to the United States when I was 5. And so I speak Spanish, but my preferred language is Spanglish. And so in college, currently I'm interested in studying something along the lines of health, human rights, and policy. And what I want to do with this is draw from public health, but also other fields like political science and sociology and other disciplines. And my ultimate goal is to be involved in public service in relation to health. And so basically, I just want my career to be focused on ensuring that everybody leads as healthy of a life as possible. And I was also a participant in the MIT Online Science, Technology, and Engineering program. And so this was me in August when I actually got to visit MIT for a conference. And I mentioned this because it was through this program that I got introduced to the topic of health disparities, which is why I'm presenting on it. Because I took a class called Science Writing, and the purpose of it was to teach us how to take tough concepts to understand and boil them down so that everyday people can understand them. And so we had to do a final project, and I did mine on access to healthcare. And through it, I got to interview the chief medical officer of Johns Creek Hospital and just conduct my own research. And it was a really amazing experience and really opened my eyes to the flaws in our healthcare system and got me really interested in it. So, here we are. All right, so some brief vocabulary. What exactly are health disparities? Basically, they're a way of describing why certain groups have higher rates of certain diseases or conditions, and as a result, higher death rates. And these groups may be classified by race, ethnicity, immigration status, disability, sex or sexual orientation, geography, or income. And in other words, they're ways of describing how factors that we can't change are associated with disease in certain conditions. And they're also normally linked with social determinants of health, such as poverty, unequal access to healthcare, lack of education, stigma, and racism, which oftentimes help explain why these disparities arise in the first place. And so, how are people being impacted? A lot of health disparities can be seen in rural populations, which normally are afflicted by higher incidence of disease and disability, and have increased mortality rates, lower life expectancies, higher rates of pain and suffering, and this normally ties in with the geographic isolation that they face, as well as lower socioeconomic status, high rates of healthy risk behaviors, and the fact that they're less likely to be covered by insurance and have limited job opportunities. All this in turn leads to a worsened health state, which can impact their health in the long run. And an example of this is how populations in non-metropolitan areas have 42.6% of excess deaths being caused by heart disease, versus only 27.6% for those in metropolitan areas. So in other words, an excess death, it means that it's a death that's preventable, and so heart disease tends to impact people in rural areas much more than that of metropolitan areas. Another example, of course, which is something that's seen here, is through HIV, TB, and STDs, and how these conditions tend to affect certain groups more than others. And another one is through oral health, which isn't something that people normally think about, but it does tie in with health disparities, as it's often affected by socioeconomic status, gender, age, and geographic isolation. And it can be seen through African Americans, Hispanics, and Native Americans having generally the poorest oral health of any racial or ethnic group in the United States. And an example of this is African American and Mexican Americans aged 35 to 44 experiencing untreated tooth decay nearly twice as much as Caucasians. And so, how are health disparities manifested? There are normally two topics that I found and did my research on were through transportation and language. And so one study found that transportation barriers contribute to missed appointments, delayed care, improper use of medication, and other factors that consequently lead to the poor management of illness and poor outcomes. And it referenced that transportation barriers impact access to healthcare in as little as 3% to as much as 67% for a population of low-income adult patients. And it also found that 25% of the missed appointments were due to transportation problems, and that bus users were twice as likely to miss their appointments compared to car users. Another big one is with language, which can of course lead to miscommunication. And one study concluded that Asian and Hispanic patients had the highest rates of developing healthcare-associated infections while in hospitals. And it recognized that several factors contribute to disparities in healthcare, like language, unconscious bias, and the more frequent use of low-quality healthcare facilities by minorities. And this all made sense when it was also found that Hispanics and Asians have the lower rates of English proficiency, and obviously this associates language deficiency as a barrier for health. And so how does this tie in with the policy that we have in place? A positive example is through Healthy People 2020, which is a program that was established in 2010 by the Department of Health and Human Services, and has 4 overarching goals. The first one is for people to attain higher quality, longer lives free of preventable diseases, disability, injury, and premature death, to achieve health equity and eliminate disparities and improve health for all groups, and to create social and physical environments that promote good health for all. And it also seeks to improve the quality of life, healthy development, and healthy behaviors across all life stages. And it does so by establishing 1,200 objectives over 42 topic areas such as health services or cancer. And then it aims at measuring 911 of these objectives and seeing their progress to certain targets with the help of health agencies like the health department and other governmental and non-governmental organizations. And clearly it's positive policy that's in place, and it's aimed at making health more accessible for all. At the same time, however, there are policies that may be contributing to already existing health disparities, more specifically policy towards the undocumented population. And an example of this is, here at the health department, how certain programs may not be accessible by a person because of their legal status, as it may be federally funded and thus require legal documentation in order for the person to seek the program. And in addition to that, the fear that many people, undocumented people, live with leads to a variety of disparities since they're willing to put their health on the back burner. And the final example is just general funding, more specifically with the current limbo that Title X is on. Various programs like testing for STDs or HIV or cancer screening are at risk of losing funding, which would definitely contribute to already existing health disparities in lower income populations. And so, as you can see, health disparities are a very complex topic, which make health only so much more complex. And so, I believe that going forward, we need to treat health as a functioning industry. And, when we do that, I think real solutions can be reached. And I think it's important to take a comprehensive approach that questions the capitalistic motives of our healthcare system, so it can be something malleable for living, breathing people and not just objects of profit. I believe that once policy towards healthcare starts taking this form, there will be less disparities, since it will be less of a blanket system and instead a more understanding, comprehensive one. And I believe that this can be done by looking at the causes of these disparities and offering solutions to them. For instance, specific policy could be passed to change the structural aspects of clinical practice, address communication and cultural linguistic competence, and all in all, ensure quality of care by monitoring and assessing it. And in the end, I think our conversation of health should extend beyond sheer monetary figures and take a complex form in order to address a truly complex issue. And that's it. Does anybody have any questions?
You did a great job.
Thank you. That's all I have. So.
That's awesome.
Thank you, guys.
Very good.
Yeah.
How long did it take you to put it together?
I've been putting it together. Well, I've been finding information